Okay, so we're talking a little bit about the management of BVD, and of course, again, the testing. We've covered testing pretty well, and we're going to talk a little bit more about vaccination programs. Okay, BVD control measures. So again, when's the best time to test these PI calves? We want to test them when they hit the ground. We want to test them as soon as we can after they were born, because if we leave those calves in with the cows and then we test them at weaning, all we've done is potentially infected the next year's calf crop. Again, maintain the new and purchased animals apart from the herd until after they've calved, and you check those calves to make sure they weren't PI. Understand the risk factors from neighbors. One of the biggest wrecks I ever had was where one guy was calving a bunch of heifers. They weren't vaccinated, they were fairly unprotected. Then there was a stocker operator that threw a bunch of very, very chronic animals into the pasture next door. Okay, so BVD can be passed up to about 30 feet, about 10 meters. It's what the literature says. So I mean, just animals with nose-to-nose contact is certainly an issue, but they can pass it back and forth through, they have to be fairly close contact, but the point is they can pass it across the fence. Okay, so again, understanding that risk, and then vaccination program, we're going to dwell a little bit more on that. Okay, so why is this disease so difficult to diagnose? Okay, number one, it's a constantly changing virus. So let's just say I've had a little bit of issues with some abortions or something. I call my veterinarian, he takes a blood sample, he sends it off to a diagnostic laboratory, and they do what's called a screening. In other words, an abortion screen, they call them. Okay, so basically, again, you need to understand a little bit about the disease and talk to your veterinarian and understand a little bit about the test, because all that test is saying, I had exposure to BVD. That could have been a vaccination, that could have been a long time exposure. That doesn't necessarily say BVD is causing your issues. So again, understand the goods and the bads and the limitations of these tests. I know I visit, with part of my job, I visit with a lot of people around the state with stuff like this, and they'll say, well, I have BVD. Well, how do you know you have BVD? Well, an abortion screen said I had BVD. Well, if they're just looking at a titer, you might have a BVD, you might not. All that says is you've had exposure, potentially through vaccination, through exposure of virus to a cow. Okay, by the time, and this is another issue a lot of times, and I visit with a lot of veterinarians, and they'll call and they'll say, Tom, I've got this issue going, and you start talking, and of course they realize that. This sounds kind of like BVD. Well, yeah, I had them checked for BVD, and we did we was looking for the organism, so we did a test to try to find if the virus is there, and it's negative for BVD, so it's not BVD, it's something else. Well, not necessarily. That virus comes, does its job, and it's gone. And I know I was talking to one guy one time, actually a diagnostician, and he says, well, I maybe can't tell you what the organism is, but I can tell you what the rule-outs. And I would argue with BVD, you cannot tell the rule-outs if you're just looking for the organism, because many times that organism just stays there for a short time. It's done its damage, it's gone. So sometimes this disease is pretty hard to diagnose. One of the things you want to do if you suspect and you have fetuses, get the whole fetus to your veterinarian if possible, and then it would be best to ship, or after visiting with your veterinarian, maybe try to drive that animal, deliver it to the diagnostic lab, because the most likely place you're going to find that virus is going to be in the nervous tissue. That's what we talked about earlier. And so again, understand limitations of testing and everything. As with all tests, you need to understand exactly what you're testing for and what that test tells you. Okay, so the role of wildlife in BVD. And to be honest with you, I think right now we don't really know. A few years ago, we said, well, deer can get it. When I was in practice, we had some issues, and I thought, and these were ranches that they did have leases and stuff. In other words, we had a lot of people on there harvesting the game on these different ranches. Well, what was interesting is one of them we thought we had some issues with BVD. And they was working with a program with Parks and Wildlife, and they were harvesting does off of that ranch. And so it was some kind of a youth program. Again, I don't claim to totally understand it, but after the season, long about January, February, they had these youth hunts, and they go in and they just slaughtered does. Well, the owner of that ranch, in working with Parks and Wildlife, we got to get a bunch of samples from those does that were killed. Then there was another ranch that they kind of a little bit more on trophy deer and stuff like that. Well, again, that was a well-managed ranch, and I didn't have any reason to suspect I had BVD there, but I worked out a deal with the outfitter there, so we tested a lot of bucks. Okay, so the short of the story is when we got back again, we were just looking at titers, so we were only looking at exposure. We wasn't saying these animals have BVD, but just they had been exposed to BVD, and their bodies built antibodies to it. Well, the does, we had a whole bunch of a bunch of those does were positive, and the bucks were, none of them were positive. And I thought, we've shown something. You know, these deer are possibly have a role in this deal with the ranch. Well, then after I got to visiting with people that understand wildlife, which I don't, said, well, you've got to understand that the way bucks stay together, the way does stay together, all of their, so that's not surprising. But the point is, deer do seroconvert. So we do know that deer can get the virus. Now, up until about maybe 10 years ago, we just thought, well, that's interesting. Then Dr. Ridpath up at Ames and some people at Auburn, they were able to actually infect some does and produce PI fawns. So we do know that again, how big is the role out in nature, but we do know they have the potential to pass it. So again, there's not much you can do about the wildlife, that just understand that's a potential problem there. So again, try to focus on your vaccination, all your other management control deals. And again, wildlife is a practical deal, might not play a role in it at all, but I just wanted to bring that up. Okay, and then, of course, I think I have a picture of feral swine there, don't I? Yeah. So feral swine could certainly potentially move the virus. But again, they wouldn't be as implicated in BVD. The concern about feral swine is that they might get hog cholera, which is, again, like we said, kin to BVD, and that's considered a foreign animal disease. If that got into the feral swine population, that could certainly wreck some of our trade issues. Okay? So we're going to talk about modified live virus versus kill virus. And if you've kind of followed a lot of stuff in magazines and you went to a lot of meetings sponsored by pharmaceutical companies, they talk about, you know, one of them sells a modified live, one of them sells a killed. And so one of them saying how bad the modified live is, and the other saying, and how good the killed is, and the other saying just the opposite, all right? So basically, if you look at the literature, and we've just completed, and we've got it right down the final stages now, a systematic review where we went back through the literature and we say, what does the literature say? Not what did, you know, I found an animal and I sent it and I got kind of a test or whatever, but what is randomized control trials, what do we find there? And so basically I can tell you that both vaccines are good. They're not 100%. Both vaccines are safe if they're used properly. So again, I think you're just going to have to figure how that vaccine fits into your operation. Certainly don't give modified live to a bunch of pregnant cows unless they've been previously vaccinated. Follow the directions on the bottle. Don't give modified live to a bunch of calves if the mothers are not protected. And again, a lot of people will argue that, well, it's all right. Well, read the bottle, and the bottle says it's not all right, so be careful there. And so again, kind of summarizing this, how much risk are you willing to take, modified live versus killed? As kind of a little trend, now again, not 100%, modified lives a lot of times will, because you remember this organism is reproducing just like the virus would naturally, so you might get a little better immunity. Is there a little more risk with, in other words, stress and stuff like that of that vaccine replicating? Certainly. So again, there's a little trade-off. That's not saying either vaccine is good or bad. I'm not here to sell one product over the other one. I'm just saying understand the pluses and minuses. Sit down with your veterinarian and have a long talk about this, you know, before you use the product. Don't just go down and somebody says, oh, this one's better or that one's better. Okay, how much efficacy are you willing to leave on the table? In other words, if you, maybe one of them with your management deal is not going to be as effective as it should be. Understand that. I will stress, if you're using a kill product, make sure you booster it, because so many people give one dose of a kill product. That most kill products, and it says so on the bottle, they need to have a second dose. That first is a priming dose. They need a second dose to get a stimulation of the immune system. So I get into this, saw it all the time in practice where people would come in, well, it couldn't be this disease because I vaccinated with it. Okay, when did you give it? Well, I didn't want to get them up again. I just get my cows up once a year, or the grandkids was just home that one time, so I just give them the one shot. Well, you could have probably got by without doing anything and had the same results. In other words, always follow the label. And so again, how that vaccine control is how it's going to fit into your program.